I've been using OMNICHROMA pretty much since its introduction to the market, and I learned afterwards that OMNICHROMA had perhaps done some bench testing of its ability to sort of adapt to the color of the tooth in which it's placed, even as the color of that tooth changed through the bleaching process. But they didn't have an in vivo case. I had a patient, I just presented moments ago and showed this case, an extreme bleacher. She had been using home whitening extensively, and a restoration that I had placed in her tooth close to 3 years earlier now looked darker than all of her surrounding teeth. And she wanted me to replace it, and I informed her that were I to use any material, we'd be having this conversation again 2 years from now because she doesn't stop bleaching. And then it dawned on me that, gee, I have a material that claims to be able to match or mimic its surroundings. So if the surroundings change, shouldn't the material do so? And I said, I can't promise that that's the case, but my gut feeling is that it ought to be able to do that very nicely. We placed it. She was thrilled with the outcome. And of course, the material, when it comes out of the tube, does not look like other composites. It's opaque and white, and it's only upon polymerization that it takes on the appearance of its surroundings. But she was very pleased with the outcome at the initial placement, and we continued to monitor its progress. She came in maybe 5 or 6 months later. She had bleached an additional 20 times, and the restoration was keeping up beautifully with its surroundings. And then I can't remember, the longest follow-up I have was somewhere in the vicinity of 2+ years. And once again, it continued to match its surroundings very, very nicely.